Bienvenidos a esta tercera sesión del ciclo de webinars de la red de ciudades. ¿Cómo se están preparando las ciudades para una reapertura ante el COVID-19? Vamos a oír experiencias de Europa y de Nueva York. Nos acompañan experiencias de Zurich, de Viena y de Maribor, de Europa. El objetivo de este tercer encuentro es que aprovechemos este espacio de diálogo que hemos venido construyendo para aprender con nosotros hoy de estas experiencias de algunas ciudades que nos llevan unos días de ventaja en esta pandemia.
How do we go back to a new normal in relationship to public spaces, commercial activity, and basically, do all this without causing a second wave of contagion? I wanted to introduce our first panelist. Penny Abeywardena is the commissioner at the City of New York City's Mayor Office for International Affairs. New York is the most affected region in the USA, as I was mentioning, amidst this coronavirus pandemic. And New York City's reopening plan is still being developed along
That's right.
Although Governor Cuomo has confirmed that the state of New York City will be reopening in conjunction with bordering states. Mm-hmm. Could you share with us a little bit more about the strategy of resuming activity, please?
Absolutely. And Tatiana, thank you for inviting me to join everyone today. It's a pleasure to be at the Inter-American Development Bank. New York City is unfortunately still the epicenter of the crisis here in the US. We have, and this is tested, we have more than 150,000 confirmed cases and more than 11,000 deaths here in New York City alone. I want to give you a couple of dates so that you understand where we are in terms of this pandemic. On March 16th, we closed all New York City schools, which impacted over 1 million youth. On March 17th, Mayor de Blasio made the suggestion that shelter-in-place order would be coming within a few days. And then on March 20th, Governor Cuomo instituted what he calls pause, which is essentially shelter-in-place. And as you can, if you've been following the news, this fight around COVID-19 has really depended on local leadership. We've had a federal government that has been rather slow to act, and so it has been up to mayors and governors, and as Tatiana mentioned, regional cooperation in terms of how we've taken this on. New York City has worked with our state government to close the non-essential businesses and schools as of March 20th, and we have been enacting social distancing since mid-March. While in the containment phase, which was that early period in March, we expanded testing, but again, this was where there was a juxtaposition between the priorities of the federal government and those of city and state, and we weren't able to get the approvals we needed and enough testing to do that. And it became pretty obvious pretty quickly that we had to go into the mitigation phase, where we essentially had to advise New Yorkers that if you're sick, it was likely that you had interacted with somebody with COVID-19, and so to self-isolate and stay at home. In this mitigation phase, we really have recognized that even though we have such a strong public health system, we did not have enough PPE, we did not have enough ventilators, and unfortunately, because of how hard New York City has been hit, it was an extreme emergency to expand our healthcare capacity. So we tripled the number of available hospital beds from 20,000 to 60,000 by adding field hospitals. So if any of you are familiar with New York City, the Jacob Javits Center became the conference center, became a field hospital, the Billie Jean King Tennis Center, and even a part of Central Park. So the good news is, and this is what we've essentially been contending with for the last month, the good news is that we are seeing the number of positive cases slowing down. And about a few weeks ago, the mayor put together a recovery team inside City Hall, who is essentially right now tasked with what the reopening will be. We are not ready to do that just yet. There are a couple of things in terms of recovery that we need to start thinking about. One, in the US, taxes have been put off until the summer. The reality is that cities and states are going to go broke pretty quickly. We do not have with both the taxes, but also the revenue from sales tax gone, we have to really contend with what we're going to do in terms of our budget. The 4 priorities that Mayor de Blasio has shared with New Yorkers as of now, anticipating the budget crisis and dealing with the pandemic as it is right now, there are 4 priorities. We need to ensure that our people are healthy, that they are safe, that they have food to eat. The mayor appointed a food czar. It was our commissioner for sanitation. She is now also our food czar, and I spoke to her the other night, and we fed over 10 million people. The reality is with this economic insecurity, and many people who didn't anticipate this economic insecurity is also struggling to procure food, and so the city and the administration is focused on that. And then the last priority is a roof over everyone's head. So it is safety, it is housing, it is food, and it is New Yorkers' health. So in terms of moving forward, we need to follow the evidence. We are looking to the CDC, as is the state, around guidelines. These are 3 indicators that need to be going down for at least 14 days before we can start to loosen restrictions around social distancing and opening up the economy. The first is the number of people admitted to the hospital with suspected COVID-19 has to go down. People admitted to our health and hospital ICUs with suspected COVID-19 have to go down, and the percentage of people tested who are positive with COVID-19 have to go down. And so the administration, both the city and state and the regional authorities, are focused on contact tracing and testing, and that is where we are trying to really build up our resources and capacity. The mayor has also appointed several advisory councils by sector, and I think this is really important because you see obviously where our priorities need to be in reopening. It is obviously going to be small and large businesses. It also needs to be around the public health and healthcare systems, arts, culture, and tourism, our labor, our nonprofits, our social services, our faith-based communities, and educational and vocational training. So by creating, bringing the best minds in New York City and New York State to help us figure out how to open these areas up. And some of the things that they are considering are questions related to how we open up a restaurant in a way that protects both customers and workers. Right now, restaurants are allowed to do delivery and takeout. In terms of transportation, everything is running, including our ferry lines, our bus systems, our MTA, all on an abbreviated schedule, but they are all still open. They're being heavily cleaned. We are requiring social distancing while you're within our transportation system, but that's because there are restaurants that are currently open for takeout and delivery. One of the areas that we are really focused on is how we are going to, what kind of social distancing will be required until there's a vaccine. What kind of PPEs will people need to wear around the city? Currently, it is required to wear a mask, and this is a homemade mask. We have really stressed the importance that medical and surgical masks are for healthcare personnel and essential workers, but if you are outside, to cover your mouth and your nose with a bandana or some sort of face covering. Another thing that we are considering as we look at reopening is the structural racism that has led to the disparities we are seeing with the COVID-19 deaths in our Black and Brown communities. For example, statistics show that 34% of deaths in New York City were among Latino residents, although that community only makes up 29% of the population. There have been 28% COVID deaths were among Black residents, 28%, and then 7% of COVID deaths among Asian residents. So we really need to take on that structural racism that has created this scenario in this COVID-19 pandemic. And so we've also launched a task force on racial inclusion and equity. The reality is that we have to deal with this pandemic and rebuilding from it. So we want to rebuild better and stronger. And so we want to take this as an opportunity to not only recover, but also transform our society here in New York City and in New York State. One of the areas that we have been ensuring that we take on as we look at COVID-19 and recovering beyond it is what we have been doing within the de Blasio administration over the last 6 years around rebuilding stronger and building a government that works for its people. So a few things that we've done over the last six years that we want to build on is guaranteeing healthcare and insurance for all, ensuring our public hospitals are financially secure, providing free mental health care for all. I am sure all of the mayors and all of the leaders from other cities on this call are thinking about that. We have a really robust mental health care program called Thrive that we have been building over the last 6 years. And that is something that we are ensuring is available to all New Yorkers right now and encouraging them to take advantage of. We want to guarantee the $15 minimum wage. We have pushed for paid sick leave and paid parental leave and rent freezes. And these are all things that unfortunately this pandemic is reaffirming is more important than ever. And just, for this, for the purposes of my being here, in general, the mayor, the governor believe very strongly in global cooperation. This is a time to exchange best practices, connect beyond borders, and ensure this global communication and cooperation is alive and well. And one of the ways that we here in New York City do it is through the Sustainable Development Goals. And so it has been very important for us to continue to connect with our peers and our communities throughout the world to exchange these best practices, but use the Sustainable Development Goals as a framework for our ability to talk to each other and share these best policies. So thank you again for making the time to listen to me today. We are at the end of a very long beginning, and I think getting through this will happen successfully by working together. So thank you so much for the opportunity to share, and I look forward to learning from you today.
Thank you for all those inspirational thoughts and the new strategy on building better from lessons, and even if it's from a difficult, tough time. Our second guest today is Anna Schindler. Anna is Director of Urban Development in the city of Zurich since 2011. Zurich has started easing already its emergency lockdown measures since last Monday. Could you let us know about, Zurich's phased approach, or Switzerland's phased approach, and also what specific measures will be put in place and the reasoning behind it?
Thank you very much. I'm happy to be with you. Switzerland has had for some short period the most people affected in relation to our small population, 8 million. Fortunately, we are not at that point anymore. We have, these figures are from Monday, we have around 30,000 people positive tested. And we have, I think today it was 1,800 people dead, more or less. But what I want to show you that it's a very different image that it's represented in whole Switzerland, because you see the cantons. These are the two maps on the back, and they show the difference. There are big difference between the cantons and regarding the distribution of COVID-19, because you see the cantons close to the border, like Geneva, Ticino, are the most affected ones. They have a big number of cross-border commuters, and they were and are also the ones who were most heavily touched. But fortunately, we had different scenarios, and we were expecting that with the scenario with light measures, we could have had up to 23,000 deaths. This number hasn't been reached, and we are very, very happy that this hasn't been the case. It was death cases, and deaths were much lower than we expected. And that's also why we have started in whole Switzerland to start our new measures to get out of the lockdown. Can you please do the next slide, switch to the next slide? Thank you. Maybe Switzerland is a bit a particular condition because we have a very democratic system, but it had never happened since Second World War. We had the emergency legislation for the first time in 70 years or 80 years, and in this legislation, Federal Council has the right to act outside any constitutional order. This doesn't apply to fundamental rights, of course, but the Federal Council took measures, different measures that like closing all the shops, closing of the restaurants and bars, closing schools, and social distancing measures and so on, that wouldn't have been possible in another period. And this was very, very something that people here in Switzerland most part of them had never seen before. Next slide, please. This was on the federal level, and as we are a federal system, after the national level come the cantons, and then the cities, like on the communities. But also the city of Zurich, being the biggest city in the country, has taken different measures. I think the most interesting ones are, beside of social distancing, prohibition of visits in retirement homes and hospitals, were that we have closed the most frequented public parks and the lakeside, for which Zurich is very, very popular, because there were simply too many people. Because when the Federal Council announced its measures on the 16th of March, the weekend after, it was a very sunny weekend and the lakeside was just full. So the city decided, okay, we close it. And this has caused a lot of discussions. In the beginning, it was very, very well accepted. And then it was, then afterwards, then the acceptance really went down. But on the other hand, I'm going to show what we also did. We had immediately installed emergency assistance for small businesses, for self-employed people, and for different economic branches. Next slide, please. This was what had happened in the last 6 weeks, and now we are at this first step of reopening at the end of the lockdown, and it's like scheduled step by step out of the lockdown. Since last Monday, we have the hospitals are allowed to undertake all interventions that have been forbidden before. We have like medical practices and physiotherapists that are open again, hardware and garden stores, and maybe most interestingly, hairdressers, because they are not very good at keeping the social distance. It's not possible to work as a hairdresser with 2 meters of distance, but they were very, very much affected. Or very much affected from the lockdown. So, and people said, the Federal Council said, okay, they are able to guarantee that they won't have more than like 10 people in the store, so they can reopen again. This has caused a lot of discussions too, because of course we have all the other businesses that say, why we also could just let 10 people into our space, so why aren't we allowed to reopen? And this will be an ongoing discussion for next weeks, I think, because we are very, very used to in Switzerland to discuss measures and to discuss decisions with all our stakeholders. But this is step-by-step schedule on May. This should be May 11th, not May 1st. We will reopen the elementary schools and all shops and markets. And then we want to wait a month to see if these measures work, if the number of infected people will not increase. And so if this is the case, by June 8, the middle and professional schools, university, and certain entertainment and leisure places, faculties, will reopen also. This is not a schedule for reopening restaurants and bars. This is not a schedule for tourism and for many other branches that are also affected of this lockdown. Can I have the next slide, please? Zurich does the same thing. I won't quote everything. I think this gradual school opening is interesting. Public spaces that you have seen before in the picture that are closed, we want to reopen them. Maybe after May 11th, if everything is well. But I think what is very interesting are all the economical measures that are taken. Of course, they are first taken on federal level, and then we have a subsidiary principle then on cantonal level. But the city really has started, since the beginning, has started to work for all our affected businesses. It goes from a strategy of support for socially disadvantaged people, for poor sections of people, for homeless people, for the people without any papers, to supplementary support in specific areas, daycare centers. For instance, we have had this situation that people were asked to work at home office, but they had their kids in childcare, and the childcare said, no, we don't want them anymore, just keep them at home if it's possible. But they still needed the money. So it was the city, I think city of Zurich was the first one who said, okay, we are going to pay for the difference between what the parents should have paid and what they can't pay right now. Afterwards, also whole Switzerland has decided, the Federal Council has decided to do the same thing. But there on this level, the city has taken different initiatives in its power, everything that it's in its power. And maybe it's to say this is a very big difference also with American cities. We have taxes, we can ask for taxes on local level. So the city of Zurich has a part of taxes that it can ask. So we also have a certain budget to dispose of, because you see the last number, the total cost for the first measures will be maybe more or less around 100 million Swiss francs, is $100 million. And then right now we are able to pay for these measures, because we also want to do subsidiary additional measures for industries, gastronomy, tourism, all the people who do events, self-employed people, emergency aid. And as you know, also big difference to the States, we have this, we have a guarantee for our wages, for our salaries. So people who were directly affected by the lockdown and couldn't work anymore, they could apply, they can apply by the canton, and they get paid 80% of their salary for as long as the lockdown goes on. So this is, I think, a very, very important basis for everyone living and working in Switzerland. Could I have the next slide, please? But as I said, it's not so easy, the emergency law that we had for some time right now is beginning to get a bit less strong. And also the Federal Council starting to get out of the lockdown wasn't that clear anymore as it had been before. So discussions have evolved. Discussions mostly about the economic crisis, and I give you just and about some measures. I just give you an example, because we have the problem how to handle commercial leases during this lockdown period. A lot of people, businesses are closed, but they should still pay their leases, their rents for their places, and they just can't. So what to do? The Federal Council didn't regulate this. They said, okay, it's not, it needs to be a dialogue between the one who owns the building and the one who has the lease to pay. So just, you have to discuss and you have to arrange. The city of Zurich said, okay, this can't be the only solution for our own buildings, and we own a lot of commercial and retail buildings in the center of the city. We are going to let the lease free for 1 month, 2 months. This is one thing. And then the city, the mayor wrote a letter to all the big investments in all the big owners of buildings to ask them to find a solution with their businesses and with the people who rented from them. And I think this letter, it was just a letter, but everyone, I saw a lot of these letters in return, and everyone just said, okay, if you get a letter from the mayor telling you that you should care about your owners, then I think you react. And there several measures have been taken afterwards. But still, I want to show the next slide, please. Still, what we are facing is an unemployment rate, and I know it's much bigger in other countries, but for Switzerland, it has already increased significantly in March in all regions in Switzerland, in every age group, not just older people or younger people. It's actually 3.1%, and I know maybe it doesn't sound like a high number, but forecasts say it will go up to 7%, and this is a very, very high number for Switzerland. I think it will be a very strong recession. So this is one thing we are looking forward to, and we are trying to figure out what to do against it. Can I have the next slide, please? And then is another big subject, big field of discussion that we have also touched before. This is the social acceptance, because it's a challenge of this dual political system Switzerland has when the Federal Council really gets so strong. And it's some discussion, the Council versus participation, because at the beginning, as I said, they showed leadership, they had a strong communication, a very clear communication, a big responsibility, they had a strategy and they showed it. And this worked well for 1 month maybe. And now getting back to normality, the cantons want to hear their voices again. They are responsible for the health system. They are responsible for planning in the implementation measures, and after the cantons also the big cities. So this is, it's going to be, it's not so easy as it has been before. And I'll give you another example. For instance, about reactivating the tourism industry in Switzerland. The Federal Council, I think it was 1 week ago, said, okay, hotels don't need to be closed, but they're mostly closed because they don't have any guests. All our frontiers, all our borders are closed. Bars should remain closed, restaurants should remain closed. And then the stakeholders from the tourism industry, for instance, all the two big tourism associations in Switzerland, last Sunday, 2 days ago, they discussed with the Federal Council and said it's not possible. You cannot just keep the lockdown. We need to discuss the step-by-step exit. We need to do it faster. We want maybe to reopen in certain outdoor areas already at after May 11th. We want an exit schedule that is completed with measures towards the summer tourist season, because summer will be here. We won't have any guests from abroad maybe, but a lot of Swiss people. So you have to rethink what you have already decided. And this dialogue has restarted, and this dialogue has been accepted very well. So for now, I'm just waiting, because I think actually this afternoon, our time, the Federal Council will announce if they will take different measures right now, as they have announced before. They show the last 3 slides. Can I have the next one, please? We have done a lot of asking people about the social acceptance also. And what you see here are 2 graphics, and it becomes clear that the population still accepts what the Federal Council says and accepts the measures taken, but they become a bit more critical. You see on the left graphic that population said in its development, the population regards the health situation is less dramatic than it has been 2 weeks ago. These dates are from the beginning of April. It was the last survey. They will have changed a little bit more up to today, but they show health situation doesn't concern, they are less concerned about that. So the urgency shifts to the economic recovery and to everything that has to do with social life. So to the reactivation of social life. And on the graphic on the right side, you see that people still thinks the communication is fine, but also there, the answers and the thoughts have become a bit more critical. Can I have the next slide, please? And as we are continuously revising everything that we do in the city, we have a pandemic organization that is monitoring everything. We have seen that communication is a very, very important item. In the beginning, messages were simple and clear on the federal level, on the city level, from the mayor, and now it gets more difficult. And what we have done in the city of Zurich, I think it's special also because we have people from more than 170 nations living here. So from the beginning, we have tried to do it multilingual in more than 17 languages, and we have immediately installed a website. We have tried to explain to everybody what is going on, and we have tried to do a target group specific communication, and I think it has worked well. It will become harder now to do motivating campaigns to just keep people up to what is still kind of a lockdown, maybe a lighter lockdown, but it still is one, also after May 11th up to these 4 weeks up to June 8th, they will be very long, and it will be hard. We need to have some good ideas to keep people motivated during this apparent relaxation of the situation, because everyone always fears that the second wave could start, that the virus could come back and could hit more than it has hit before. And I just go to the last slide, please. And I think they are conclusion. We have done a lot of exchange with other cities. We have looked at Vienna, that will be part of this webinar too, and a lot of cities in Italy, Milan, because they have been some steps in advance, always some weeks in advance. They have had a lot of much harder problems also than we had, especially in Italy. And we have tried to develop, and we are still developing, what is the right thing to do. I think it's target specific measures, it's maintain the motivation, as I said before, and it's also all this discussion about tests and tracing. We are developing apps right now, as everybody does. But I think the most important thing, looking from a point of view of a city representative, is really having clear measures, communicating them in a very clear way, and do everything to explain to people in different languages, in different ways, why it's necessary that we do everything that we do, that it's necessary to keep social distance, and just don't let them behind. Thank you.
Thank you very much, Anna, for sharing your experience in Zurich. And as you mentioned, our next day today is the city of Vienna, who is represented through Klemens Himpele. Klemens is director of the Department of Economics, Labor and Statistics in Vienna since 2012. Austria was one of the first countries to start the mandatory lockdown. And also since 14th of April, it has started loosening restrictions. I was wondering if you could share with us a little bit about the process and also about the indicators that had followed. And almost 2 weeks into it, what results are you observing, and also is technology help you at all in moving forward?
Yeah, thank you for having me. Vienna has around 1.9 million inhabitants. It is the capital of Austria, a small country in the center of Europe. And up to now, we had less than 2,500 positive tested COVID persons within the city. Among them, 1,800 recovered, 127 died. So we have actually around 520 persons with COVID-19 within the city borders. What did we do? Well, there is a lot of things which are very similar with the topics Anna mentioned from Zurich, social distancing and masks and so on. But let me start with the unemployment and the economic problems we had following March 16, when we had the lockdown you mentioned. With March 16th, everything was closed in Austria. Just the supermarkets and the pharmacies were open, and also the borders were locked down, which is a problem for the tourist sector, of course, and so on. So we had an increase on around 30% of unemployment within 1 day. And this is the main topic we have from economical point of view. Of course, as in the other cities as well, the lead is with the epidemiologists and not with the economists, because the first thing you have to do is to protect your hospital system. I think that's clear, but besides that, you need to find solutions for the economy and the social life in the city. The most impacted sectors in Vienna were accommodation and food service industry, arts and entertainment, education, of course, wholesale and retail trade, and the personal services like the hairdressers. It was a really interesting news that Zurich opened hairdressers first. That's the thing we do different here. Then we had a danger of insufficient labor supply in construction, accommodation and food service industry, manufacturing and so on, due to the fact that a lot of workers in Vienna come from the Eastern European countries. And when the borders are locked down, then they cannot enter the country. And that's what happened right now. Just to give you an impression what the lockdown costs us, if you have a lockdown of 50% of the wholesale and retail trade sector, then it costs Vienna every week 816 million euro. So you can go down to the sectors and you see that it costs a lot of money. The federal level has a budget from around 38 billion euros to help the unemployed persons, the firms and so on to come to the lockdown. And as Zurich showed, with the same with the GDP in Austria, the prognosis says that we will probably have a minus of 5%, 5.2%, which doesn't sound that dramatically, but they probably will correct it again. And it is a dramatic situation in economical view. Most of the measures we have in Vienna are done by the federal level. This is Austria is a federal state like Switzerland, but the Swiss situation is different because the Swiss cantons are able to raise their own taxes and have much more supporting measures. The main measures are done by the federal level. And of course, it is about social distancing, it is reducing social contacts, avoiding larger groups. We have mandatory masks in supermarkets and in the public transportation system. I think New York mentioned something similar. And we have, and that's the most important thing, and that's also the question with the technology, we have a case and contact tracing. If you want to avoid a second wave and a second lockdown, then you have to go after every single positive case in your city. And that's really a hard task in a city. I mean, Vienna, I mentioned, has 1.9 million inhabitants. I have no idea how a city like New York is going to do that, because this needs a lot of resources. There is a study from Germany which says you need 5 persons for 20,000 inhabitants, which means 500 persons in Vienna just doing the case and contact tracing. Of course, we use data scientists, but the technology with the apps is not so far developed that you really can use it. So this is really the thing we want to do. We are not mitigating. We try really a containment of the virus. We will see if we will be successful, but that's where we are now. And then, of course, that's what Zurich mentioned as well. Awareness and information campaigns is the most important thing. What we have now, I'll come back to that. We opened the first shops 2 weeks ago. And now the mood in the city is like, oh, everything is allowed now. You know, the shops open, the kindergarten's open, the school is opening in 2 weeks' time. And everybody's like, okay, so we can go outside and have our normal life. And no, you can't. You have to keep your distance. You have to wear your masks and so on. So that's this time schedule. The first, until the 14th of April, there was only the critical infrastructure was open, which means supermarket, pharmacies, and so on. On 14th of April, it was the Tuesday after the Easter weekend, we had a reopening of all small shops below 400 square meters. And the garden centers, don't ask me why, but I think it was the same story in Switzerland. This is more than 2 weeks, it's 15 days past now. And till now, we do not have a really hard increase in the numbers, which is good news. By next week, all other shops will allow to reopen, as well as the hairdressers, but we have them in the second wave. And we will have a reopening of schools, and also on the 1st May there will be the playgrounds open, and we will have an opening of the schools by mid of May. Also the restaurants will open by the 15th of May, but you are only allowed to have 4 persons at the table, and between the tables you have some space. You need some space, That's the rules for the restaurants. It is much more easy outside than inside, by the way. Yeah, and then we have also reopening of the kindergartens. By the end of May, 29th of May, the accommodation industry will reopen. Same problem like in Zurich. We will see who will come to stay in a hotel, and we will have an opening of the swimming pools as well, so that the summer season can come, because our physicians say there is no problem with the virus in the water. What is the government structure? We had the good situation that we have a Vienna Economic Council. This was established long before the crisis. It is a city councillor. It is the city departments. It's my person. It's also Vienna Business Agency, and it is the representative of the employment and the Chamber of Labor and Chamber of Commerce, which is very helpful now. To the fact of communication, to have short ways if there is a problem coming up, because what you will see, there is a lot of pressure, of course, from all sectors that they want to reopen now, and you have always to check sector by sector, is it possible from a pharmaceutical point of view. Besides that, we have, of course, the crisis committee, the Krisenstab. Probably you have it in other regions as well. And this Krisenstab, this crisis committee, is not only on medical issues, but also socioeconomic and psychological issues, because this, I think, is in a city maybe even more important than on the countryside, and that is what we have to do. Then just some ideas what we did, what Anna mentioned from Switzerland, you can find in Austria as well. We have, of course, supporting the unemployed persons, but this is done by the federal level. This is not done by the city level. What we did, for example, is financial support to build up the online stores, because we have the same problem like most of the cities. There are some huge online brokers outside our borders, but the small enterprises have some problems in dealing online. We had some financial support for home office technologies. It's also have to do with the technologies, because one of the main problems you have in a city, and I think it was the same in New York when I followed the media, right, is of course a public transportation system. So every way you can avoid is a good way. That's why home office is so important. It's not so much because of the offices, it's much more because of the public transportation system. We have public guarantees for bank loans. We have participation in critical enterprises. This is the way Vienna goes. It is challenged by some other political directions, but that's what we decided in Vienna. And of course, we have a deferment of regional taxes and so on. But most of the taxes in Austria are on federal level. So what we do, of course, is a close monitoring. We have the numbers every day. If the increase in the newly infected persons is higher than the day before, then we have meetings to ensure that the case and contact tracing is in place, that we can find the persons, because if you lose them, then you won in a second wave, which means a second lockdown. And this is very, very expensive. And I don't know if the psychology of the Austrian or the Viennese people will be able to have a second lockdown, because we were locked down for almost 6 weeks. You have the children with you in your home. The kindergartens were open if you really needed them, but you shouldn't use it, and only 2% of the parents use the kindergartens. But that means you have home office and homeschooling and home care for your children, which is really, really hard. If you have a balcony, it's fine, but if not, then it's a problem. And we had really, really sunny days in the last weeks, not today, but in the last weeks. And this is really, there was a hard argument about the parks. The city of Vienna kept the parks open. They said the people need the space to go outside, but we have some federal parks in the city as well, and the federal level closed the parks. So there was a huge argument, is it good to have the parks open or not? Well, that's what we do. We will monitor if the situation changes. We have to change the plans. That's easy like that. And I think that's what you can learn. There is no agreement with the virus. You cannot say the virus, we do that and then you do that. You need really to go after the numbers and decide day by day if you have to maybe to close again some of the things you reopened. That's what might happen. We are a little bit optimistic that it might be a little bit easier in summertime. Because outside, that's what the epidemiologist tells us. outside it's much more unlikely to catch a virus than inside. But still, you have to be very, very careful what happens the next days. The sectors which are we don't really have an answer is the hotellery, the tourism sector. Of course, in the countryside, it's hard, and the culture sector, how to do with the opera house or with the theater. That's really not so clear how we can find solutions there. Thank you for inviting me.
Thanks, Klemens, again. Very good. And the last guest that we have with us today is from Maribor, Slovenia. And it's NatašaRitonija. She's the head of international relations in Maribor. I was wondering if you could share with us a little bit about, your strategy and the challenges that a smaller city may have might have gone through the COVID-19 pandemic, and now obviously the reopening of the city.
Well, thank you very much for inviting me. First of all, why showing a map? Because a lot of people do not know where Slovenia is. Slovenia is a small country in the middle of Europe, and also Slovenia is the only country with the love in its name. So I hope love will help us also fight against the virus. And the second reason is because Slovenia is also the neighboring country of Italy. And a lot of Slovenians commute daily to Italy to work there. And since Italy was hit very hard by the virus, we also had to take certain measures. And what was more, in February, the last 2 weeks in Slovenia, there are winter holidays and lots of families go to Italy for skiing. So lots of the imported cases actually came from Italy. Since Maribor is not direct at the border with Italy, but we still had to take measures very soon. The mayor's cabinet had to reorganize the workflow overnight, and we contacted all the crucial stakeholders in the city, like civil protection services, humanitarian services, health professionals, and others, and formed a body. And please go to the next slide. This was a crisis unit which was run by our mayor, and actually the municipality operated on 3 levels. The first level was on the city level, combining and connecting all the stakeholders. Then on the regional and national level, lots of mayors decided to work together in this crisis. They also formed a group, informal, and also exchanged the data, the ideas, and so on to fight against the virus. We also had a very good contact with our government. And the third level was international level. We worked very good with our partner and sister cities around the globe. We also run quite some projects jointly regarding the volunteers and so on. So this was basically the 3 levels we were running. Our mayor actually was the first mayor in Slovenia that imposed the lockdown in the city, which happened already on the 12th of March. All the restaurants closed at the time. Also schools, and we at the municipality started working from home. So we were the first one. And the national lockdown happened on the 15th of March. Also the public transport was stopped at the time. Please go to the next slide. The very important thing for us was to communicate. So we communicated with the public. We organized, launched a new website with a phone line. We helped the people in need. We expanded the volunteer network. And we also provided accommodation for the medical staff of our medical center, so that they could stay near the hospital and not go home and spread the virus among their loved ones. We also enabled free parking for the medical staff and also in the city center. And we started also preparing meals for school children, because you have to understand that in Slovenia, children in primary schools, they get 2 meals during the school. And for children of deprived families, background, these meals are for free and paid by the government. So now lots of children were without a hot meal. And we started to prepare the meals and also to distribute the meals to the families. We also provided meals for elderly people who now didn't have anybody to take care of them because of all the restrictions, and also distributed meals to the elderly. We also took some measures regarding the homeless in our city. We do not have a lot of homeless people, but still we organized public toilets for them that were opened. Then we delivered a warm meal for them, and also we found a location for self-isolation in case of infection. We also, what we did, we prepared some, we said COVID packages together with the Red Cross and Caritas. These were food and hygiene packages to distribute to those affected by the epidemic. So this was basically the major measurements that were taken for the population. Please, next slide. You have to understand that the people in Slovenia were following the news every day and seeing what was happening in Italy, and they followed the rules really strictly. That's why we really stayed at home. We didn't have any severe restrictions, like, for example, in Spain, when people are not allowed to go out. So we could go out, go into nature. We didn't have any restrictions regarding that. We could go into parks and so on. But people understood that the situation is very serious, and they really stayed at home. And that's why the numbers in Slovenia are really, let's say, low in comparison to other countries and other cities. Can you please go to the next slide? And what is more, we also did a lot with our partner cities in China, because Maribor is also a sister city and partner city with 12 Chinese cities. So in these times where it was really difficult to get the medical equipment, we got quite a lot of donations from our Chinese partners. So our municipality could distribute all this stuff to, let's say, to our hospitals and public services, also for elderly homes, nursery homes, and so on. So we could do that. Maybe other cities didn't have enough at the moment, enough medical equipment to do that. So that's why also the numbers were not that high. Could you please go to the next slide? Okay, so this is the situation in our city. We only had 119 positive tests in Maribor. You can see on the chart the situation at our medical center, but since our medical center is a regional center, it's not only the numbers for our city, but also for the region. You could see from the slide that we have a stable number of people in intensive care. It's around 30, 10 4 people have deceased in our medical center, and 65 were released. Next slide, please. Okay, these are national numbers. At the moment, we have 1,418 positive tests in Slovenia, which is 10 more than yesterday. In the last 10 days, 7 to 10 days, we have around 10, even less, 215 new cases per day. So we are quite happy with these numbers. We had in total in the country 86 deaths and 52 conducted tests. It's around, this is national. Next slide, please. Okay, now last week Slovenia started with the national study on the prevalence of the coronavirus among the population. Slovenia is now the first country doing such a study. In this study, we will look for active infections, because they will be taking some samples from nasal part of the throat, and as well we will take blood samples to check for antibodies. So the preliminary results will be known by the end of this week. So how was this conducted? First of all, 3,000 people were randomly selected from the central population register. There was no age restrictions, so they included residents of all ages. In the first steps, 300 areas in Slovenia were randomly selected, and then 10 people were selected within each area. So this sample is representative of age, gender, and territorial distribution of Slovenia, and will allow generalization of the survey results to the entire population of Slovenia. So this kind of data will be needed to release the measures. So we are really looking forward to the results. Of course, we can open the country without the data, but this is risky and can mean closing down again and lockdown again. So this survey allows us to obtain the first solid, credible data on the basis of which competent institutions can prepare and adapt measures to tackle the epidemic. And we will see when we receive the results if the measures can be released in one part of Slovenia or for one city, and then again imposed in another city. Well, similar research, but to a lesser extent, has already been conducted in Austria. But in Austria, they were just looking for the infected people and not from all those who really recovered from the virus. As I said, the first preliminary results will be known this week. Next slide, please. Well, what to do next? So we already started to reopen. The first measures were taken last week with reopening some stores for gardening, specialized stores for cars and bicycles, dry cleaning, and so on. So this started last week. Also, some sports activities are allowed again, like cycling, tennis, then golf, and running, of course, outside. Then from today on, museums, galleries, and libraries are open again. And what is very important for fathers, they can attend the childbirth again from today on. But from the 4th of May, small shops can reopen again, then hairdressers, beauty salons, it will be also able to go to church again. But what is very important for the economy is that we will open restaurants and coffee shops. but only those will be able to serve who have gardens and terraces outside. So there will be strict measures, like Klemens said before, so certain distance between the tables and some protocol that they will have to follow, but this will be able from the 4th of May. And maybe from the 11th May, the schools will reopen and kindergartens, but it's still not, it still hasn't been decided yet. We will see. We will, well, the officials will act according to the epidemic picture. So let's hope that at least kindergartens will open, because otherwise it will be very difficult for some people to go back to work if they have small children, because our municipality is also very reserved to the fact that the grandparents will babysit the children, since they are the most endangered age group, and according to our data in Slovenia, 95% of all deaths are 65 plus of age. So that's why we are really reserved to that, and we really hope that the kindergartens will reopen first, and then we'll see what will happen with the schools and primary schools and high schools. Okay, so this was very brief from my side, and I will be then open for questions in the second round, and with some measures as well. Thank you.
Thank you very much, Natasha. With that, we're going to pass to, we've had a lot of questions that were coming up as the presentations were going through. And we're going to pass to the questions directly. From our audience, Penny, we have a question for you with a lot of interest. You mentioned the fact that, you know, the indicators that would determine the reopening or if you want the steps towards reopening were linked to a decrease in the number of cases of COVID. And the question that is being asked is, do you have specific targets to meet, and over what period? That would be our first question.
Yeah, the specific target right now is fluctuating. So one, it's something that I heard other presenters talk about. I think it was our colleague from Austria that said, how are we going to do it in New York in terms of like the contact tracing and the testing, and that we really need to invest. The mayor just announced a task force of 1,000 new sort of disease detectives, contact tracers. We're going to have to ramp that up. And we're trying to figure out how best to get all the capacity. Philanthropy and the private sector are supporting a lot of our initiatives, and that's why we have the different task force. What was the second part of that question? Oh, the period of time, it has to be at least 14 days. Okay. It's a good question about what the exact target number is. I have not heard the mayor or the governor talk about exact numbers. We just know that we need to see the decrease in each of these 3 priority areas, and they need to be consistent over a 14-day period.
Okay, that's great. Thank you, Penny.
It's a great question, and I will look into it, and if I get even more clarity, I'll share it with you so you can share it with the group.
No, I think it's great because, you know, in most of Latin America and the Caribbean, we are at that stage in which, you know, a lot of the criteria is being determined. So knowing, you know, the way in which, you know, New York is structuring, you know, a health and safety, you know, measure or criteria that will trigger reopening will be of great help.
And I think that the trigger is a good point. Something that both the mayor and the governor reaffirm pretty much every day is how carefully we need to do this. We're experiencing this current wave, but we're even more scared about the second wave, to be completely honest. And if it coincides with the flu season that's coming up in fall, if we reopen too quickly, it'll be more damage than what happened this first round. And so that's like at the utmost at the top of everybody's thinking in terms of what this reopening looks like.
Thanks, Penny. And linked to that question, I have another question for both Zurich and for Vienna. And the question that comes from the audience is, what criteria did you use for reopening? And basically, how, what were the priorities in terms of health and potential, epidemiological contagion, and, economic needs to actually determine your phases?
Thank you for the question. I think it's both. Actually, we are looking at decrease of numbers. So as soon as this curve became more and more flat, it was a sign over the weeks, just over the days. Maybe it was since the last 14 days. I think that it's becoming flatter and flatter. This was a sign that we had less infection, so we could discuss about reopening. And on the other hand, it's also economic pressure, because the whole economic crisis is going to cost us very, very much money, and a lot of money. So it was, I think it was a big debate between health and economics. And I won't say that economics win, but as soon as the health department said, okay, I think we can take the responsibility to reopen, so let's do it, because social pressure and economic pressure get just too strong if we don't.
Thank you, Anna. Klemens, may we have the same question for you?
It's pretty much the same here. I mean, the aim in the beginning was to protect the hospital system. So that was, of course, the most important measure. Do we have enough beds in the hospital system? And then we had, of course, a number of infected persons, of new infected persons, which really go down in the weeks after the lockdowns, followed the lockdowns. What we did in Vienna is we looked at the sectors and the value added they have, but the decision was made on the federal level. So it was not a decision of the city of Vienna. But in the end, like Anna mentioned from Switzerland, it's a little bit a compromise between the economical situation, the social situation, and of course the lead is by the hospital system. Do you have enough beds for the infected persons? And we always had them. I mean, we have a high number of beds in hospitals in Austria, which is good luck to us at the moment.
Great. Natasha, I have a question for you. We would, you were apparently very effective in communicating, in the sense that there was a very, tight follow through from the population. How did you manage these, and what methods did you use to reach to the population and to ensure that there was full compliance?
All right, so on the city level, we communicated with the public via our webpage and via Facebook and Twitter. Our mayor also shot quite a lot of videos for the public. And we also, together with our newspapers and together with different media, together we had I would say the common goal to inform the public about the pandemic. So this was a very good cooperation between different stakeholders and also the media, who helped us quite a lot. Also the newspapers, regional newspapers, regional online media, regional radio, and so on. Not only, I would say, the channels we usually use at the municipality.
Thank you. We have a question asking whether e-commerce, which has seen a huge gain in popularity and acceptance, can help, balance the revenues of the cities, and whether you have explored that.
That is a good question. I haven't. I could look to see if our colleagues in our Economic Development Corporation have been looking at that. I think the challenge too is that federally, taxes don't have to be filed until mid to late summer, which is putting it off from April, right? And so I think even if we explore that, the reality of the federal government being able to figure out how we even get our tax system going, and that happening in the next couple of months is really going to be pretty devastating. And then also you have to remember, one of our challenges is that we've had to invest so much in our current health crisis that, you know, this is taking away money that we had for other programs, but now we're depleting those funds as well. So we're being sort of attacked from all different angles. But the e-commerce angle is an interesting one. I will look into that.
Thank you, Penny. I have so many questions for Vienna. Klemens, you have highlighted the fact that you know, commerces were, you know, you're 2 weeks into the reopening, things are moving forward. We have questions regarding whether the population is back to the shops or not, and to what extent, and two, whether, you know, there may have been a change in behavior that may be long lasting, and how can we rebuild confidence among, you know, the normal citizen to get back onto the, you know, to the street and back to the small, if you want, local producer?
Well, we don't have exact numbers, but what we see is that the shops are not as crowded as they was before the pandemic. So it's totally clear. Most of the people just go outside to buy the foods and drinks, and that's it. Yeah, but it changes slowly. Yeah? Every weekend with nice weather, you see more people outside. And the problem we have now is more that I think some of the inhabitants of Vienna think that was it, that the virus is done, but it isn't. We still have it in the city, and it still can, the number of infected can increase quickly. But of course, the people are still, you know, you have to wear the mask, which is not, we are not used to it. So all the people, I know, with this mask in the shops and so on, but it gets better and better. And I'm quite optimistic that this will not be the problem. The people will come back to normal life. We have to make clear that they still have to keep the distance, that they have to wear the mask, that they have to wash their hands whenever they have a possibility, and so on. All the measures we had before, and then we will see if it's enough or not. But at the moment, the shops are not as crowded as they was before. And the public transportation system still is, it is used, but it's far away from what was 6 or 8 weeks ago.
Thank you, Klemens. Anna, I have 2 questions for you. One of them is, you highlighted during the presentation there was quite a number of bans that, you know, had been put in force, and that, you know, are slowly being lifted. Are there any incentives that are complementing those bans in general? And then the second one leads from what Klemens was telling us right now, and it regards the transportation system. Is there also a stepwise process to basically bring back, you know, urban public transport systems back to normal? Are any other alternatives being considered? Like, for instance, in Bogota, you know, there's, you know, more bike lanes being, you know, expanded. Is there a change in the mobility process that you are, you know, you are pursuing?
Thank you for the question. Now for the second question, second answer first, maybe, because I have really actual news. Our federal council is holding press conference right now, and they have decided, as I explained a little bit before with the tourism, it's the same thing with mobility. They will reopen and get back to normal, you know, rhythms after May 11th already. It should have been done only in June, but they will start on May 11th, and therefore they will go back with all the public transportation to the normal schedule, to the normal rhythms, and we don't take any other measures. I heard the same thing from Milan, for instance. They are promoting bicycle lines instead of public transport. We won't do that, but I think there will be less people in public transportation for the beginning, also because we are going to continue home office, not as a ban, not enforced, but for everyone who can do home office and who is able, doesn't have all the children at home. So we are also hoping in the whole city, between all the private enterprises and the administration, that the situation will get a bit flatter, so that we won't have everybody on the same time in the same train, so that people will be a bit more flexible. We did subsidize in some way parking lots for people who still needed to come to work and needed and had to take their car. They could get a free parking permission for the whole time. It was a limited number, but I think it was more than 20,000 in the whole city. And we did subsidize. We subsidized a lot of businesses, of self-employed businesses. Sure. All the businesses of people working in arts and music and leisure, but we didn't do any subsidizing for just for everybody as an incentive. We didn't do that, and people accepted it. They accepted it very well at the beginning. It was really, I think, most astonishing, actually.
No, great. I think this was truly unprecedented. Great. And my last question to Natasha. I wanted to ask Natasha, what do you think, you highlighted in your presentation the impact that, your proximity and your exchanges with Italy had in basically your actions against the pandemic. I'm wondering whether there is any measures that are specifically being taken at the moment in relationship to the reopening of the borders.
Mm-hmm. Well, this is a state matter. Okay. Yes, I think that yesterday our Minister for Foreign Affairs was in Brussels and they were discussing. But I think that since Slovenia has a quite good the pandemic picture at the moment, as well as Croatia, our neighboring countries, we might have some bilateral agreements between the countries to open the borders, but I don't think that the border with Italy will open soon. We think that maybe first with Croatia and Austria, Hungary, and then Italy, the last one. But since Slovenians really like to go to the seaside, to Croatia, I think that there is quite a big pressure to reopen the borders with Croatia.
Great, thank you, Natasha. Just to very quickly summarize, we have prepared some brief charts in the presentations. I think we have some from New York City. Penny really highlighted the impact that COVID had in the city, how local leadership at city and state level was really critical in the case of New York City in taking action and moving forward and basically managing the pandemic. She also highlighted the impact on the tax of the city. Sorry, can you come back? Yeah, the recovery, how the recovery team is working, how it's setting priorities, ensuring that people, healthcare, and housing are being supported. And also, how they have a plan for moving forward in terms of ensuring that there is certain triggers that will allow the reopening. One of the things that I love from your presentation, Penny, is also the fact that you're taking this opportunity not only to get over the immediate pandemic, but also to have a recovery that is transformational, that takes that tackles the structural differences in between the different citizens in New York, and provides equitable services, including in the future health and insurance. And I love the the central point about the SDGs, and would love to talk further about it. Sorry. The next insights from Anna. Once again, I think in her presentation, she shared with us, the concept of the reopening with how it merged with the necessity for protection, the three-step phase that it will follow, as well as how subsidies for different sectors and how different sectors were supported during the pandemic and as they come out. There's also a current discussion about many issues that regard the reopening and how those will be handled and monitored as they go through. We had a question that I couldn't ask you, Anna, but the polls and the surveys were of great interest, with many of our audience, and I'm sure that would be maybe an area for follow-up, and the importance of communicating through the decision makers' main messages. From Klemens, we heard, we learned about, the federal government measures that were put in place, from the beginning, from social distances, hygiene, and how these are being, eased off little by little. There's, in Austria and specifically in Vienna, there is a reopening that is taking place in 4 phase areas that, still need to be resolved as, the process advances, including arts, theater, and tourism. Tourism is a huge problem, for us also in Latin America and the Caribbean, and also how to build that confidence that we were talking about earlier on. And there is also, potential for financial support that has been provided all throughout the process. And lastly, for the city of Maribor, Natasha shared with us the extent, the origins and the extent of the COVID-19 pandemic, how it was, at multiple scales, and how, from the city, led by the mayor, it was handled, but it was also coordinated in between, local and federal and international levels. The reopening will happen in 3 initial stages, and then we have to see what the results are, like in many other cities. And last but not least, you have launched a national study to really, make sure that is statistically representative, despite of the very few cases that the region has seen. So with that said, I wanted to thank you all for sharing and your experiences with us so openly, to answer to so many of our questions, and also from many perspectives.
Vamos a tener un nuevo webinar sobre este mismo tema, en el cual queremos oír a las ciudades de América Latina, y vamos a trabajar en grupos pensando en cuáles son esos temas que son claves a la hora de reabrir las ciudades. Allí vamos viendo en la pantalla lo que va saliendo, lo que nos va contando la gente, de cuáles son sus mayores preocupaciones. Bueno, creo que ahí todos ustedes también van viendo los temas que van entrando en esta nueva etapa de cómo reabrimos las ciudades y cómo empezamos a sentirnos más con mayores preocupaciones, pero también viendo cuáles son las medidas que podemos ir tomando. Y creo que hoy, ya para terminar, queremos agradecer a nuestros participantes, a nuestros panelistas por compartir con nosotros estas experiencias que creo que han sido inspiradoras para las ciudades de América Latina y el Caribe. Muchas gracias, gracias a todos y cuídense mucho.